Good afternoon. This is Jim Karp along with Kurt Nirenberg and Chris Hunt. Gentlemen, how are you today?
Doing great today.
All right.
Doing well, thank you.
Good deal. Hey, we're going to talk today in regards to getting your dental practice back up and running. And Kurt, you've put together 4 high-level items. First, you want to make sure that you've got the office policies nailed. Make sure that you can effectively communicate with your patients as well as your team members. And then there's a whole bunch of operational considerations that we want to go into. So let's go ahead and get started here. What's the first item that you think is important from the office policies?
I'd say the biggest thing is just to kind of take a look at, the thought process that you have to go through as an owner in a practice and determining really what your policies and procedures are. And, these days it's, the main focus is on the PPE that you're utilizing. Many people are going to look at the CDC and OSHA guidance that helps them kind of situate what that's going to be. At the same time, you're taking a look at, for the PPE itself, maintaining it from a day-to-day basis, as well as when it's no longer any good, how to dispose of those items.
Kurt, in addition to the PPE you're talking about, what about social distancing?
Social distancing measures right now are a key component to make everybody feel safe. It has to do with, evaluating traffic flow and patterns within your office. It has to do with staggering start times for team members that are coming in, break times, lunch times, having not only the time slots be different, but where people can feel comfortable in an area so they can take their breaks and regenerate themselves for the day. And then the last part is realistically, the screening protocols, what you're going to do to establish that people coming into your office are safe and healthy, both from your patients as well as your teams itself.
Kurt, I think those are all great points. We've heard some silly things that, they're not really so silly when we're dealing with COVID-19, but talking about replacing or removing magazines that are in your office and setting the chairs 6 feet apart. Those are all things that are going to be important from a perception standpoint as far as for both your patients and the staff. One of the things that I think is important when we're talking about policies and procedures is everyone's heard now the term, the preparedness and response plan. And I think that is going to be, all of these things that you're talking about, utilizing PPP, maintaining and disposing of or PPE, social distancing measures, all of these things can be included in that preparedness response plan. And I think that is probably one of the most important documents that you're going to need to have from a policies and procedures standpoint to start out when you open up your doors.
Yeah, and that leads me to the last point, the protocols to have set up for your office as far as for team members that are either that contract COVID-19 and what you have to do for employees or team members that are ultimately subject to being exposed to COVID positive individuals as they come in the office. That right there are probably the main components right now, both for offices that I have out of state that have opened up, that have had these issues, and things that I tell clients right now, your greatest hurdles coming your way are going to be managing those situations right there. So to get things documented and get things set and educate the team on what it looks like ahead of time is so important to prevent a panic or an uncertainty or yourself just, worrying about those things as it happens. It's going to be a stressful situation. So if you can apply these and set these protocols when your mind is clear and settled, it'll be so much better as you have to manage these situations in your office.
Just one more comment on the preparedness and response plan. That document it's a requirement in the state of Michigan, at least. It came out as one of the executive orders. We're up to almost 100 of them now, but I think it was 2020-59 was the executive order that talks about the preparedness response plan. And for those of you that haven't thought about this yet, the Michigan Chamber of Commerce actually has some sample preparedness and response plans that you can look at based on the riskiness of your business. And in our case, we're talking about dental offices, and that's going to be the highest risk opening that we have. And they do have response plans out there that you can take a look at and kind of guide to get your thought process in order of what needs to be in it, what you need to communicate to your staff, and kind of the steps you need to take to make sure that you're covered from a policies and procedures standpoint.
You know, the next key component to really need to focus on is really going to be the communication to the patient. Hey, we're open now. Come see us again. And letting them know also that even though the practice was a safe place to be prior to COVID-19, hey, you know what? We've made some enhancements. We've done some things that'll make it even healthier and safer to come in. Chris, you mentioned earlier, you know, taking the magazines and things like that out of the, you know, reception area and stuff like that. I think one of the other big things is that patients are going to have to get used to, you know, they were coming in, you know, they'd show up in the parking lot, they'd get out of their car, they'd come on over into the office, they'd see people, say hi, the reception area, there'd be people in there. Now it's completely different. And to let them know what that is going to be, so it's not a surprise to them. Let them know that when they arrive in, I know I have a lot of practices that as patients come in the parking lot, they're sending a text or they're calling the office saying, hey, I'm here. And the office actually has to let them know it's safe to come in, or I shouldn't say safe to come in, it's time to come in for your appointment. Or what some offices are doing, or they're sending out somebody to the car to take the individual's temperature with a touch-free thermometer. And then at the same time, they're also going through their dialogues and asking the questions to triage and make sure that that patient's available to come in and into the safe environment and keep it a safe environment. You know, so many, and we have to keep it in a fashion that patients feel like, okay, it's just an extra step. It's not that they don't have to feel like, oh my gosh, you know, am I being second guessed, or are they thinking I'm not a safe person to come in here? It's just a new protocol to keep everybody safe.
One of the unique things that I've heard some practices utilizing, whether it's a medical or a dental practice, is, you know, when you go out to eat and you have those buzzers for when it's your turn to go be seated. You know, when you go to take someone's temperature, if you have some of those buzzers, you could give it to them so that they could get buzzed in when it's time to come actually in the office. So I just thought that was a unique thing that I had heard over the last couple of weeks.
Yeah, you know, and even kind of, you know, when we communicate to the patients, you know, I have offices that are putting information on their website, emailing or texting information to the patients, that way they know when they arrive, you know, they should be wearing a mask, and they should be, you know, be prepared that as they come in, they're going to, you know, somebody will be either having the doors open for them, or the doors will be open. They're more or less going to walk in, go back into the operatories. When they get there, they're going to be washing their hands. They're going to be probably rinsing, you know, their mouth with a certain rinse that the CDC and OSHA have talked about may be beneficial. And then they have to realize they're going to go through the treatment, get what's done for the day, and pretty much do the same thing. Wash their hands, and all of a sudden it's going to be like, as a rule, they usually come up to the front desk and they talk to the front office person, you know, make their payments, do different things, maybe schedule their next appointments, and that's going to look different now. You know, they may be walking right past the front desk because the offices may have new protocols and scheduling, patient payments, to do this online, website, and things like that. So there's a lot of interesting things that offices are doing to make it a pass-through or limited touch environment for the patients.
Okay, gentlemen, we've had a chance so far to discuss the policies and communicating with your patients, and as well as the policies. So how about setting the stage for your associates and making sure they understand the expectations as well?
Yeah, you know, as we talked about the communication with the patients and them kind of feeling safe and feeling like it's a great place to be, it's only going to feel as safe and as a happy a place as much as you portray it to be. And to be able to do that, the team has to be fully on board. The team has to be educated. The team has to understand what changes you made, why you made them, and have to be really on board. So that way when patients, patients have a pretty special relationship with the team members as well. And they're going to ask questions, and the team members need to be able to say, hey, you know what, we did this, we're doing this, doctor did a great job getting things ready for you in this capacity. But before you can actually communicate to the team, I'll tell you what, there's one step that has to happen. First, you got to make sure if your team is comfortable. You have to go through and educate your team and talk to them, one, about their expectations when they come back to work. Are they coming back to work? That's one of the biggest trials and tribulations right now for practitioners, is making sure that their team that's been accountable for so many years, that they feel comfortable, want to come back, that they are coming back, and in what capacity. And so, as I know, I'm telling my clients, hey, you know what, as you communicate with your team members, give them a couple things. One, send out a survey to them. Send out a survey ahead of time, just asking what's your comfort level, what's your availability as you come back. We're all trying to balance commitments and, distractions with, children still not having appropriate daycare or having to care for somebody else that may have some issues. So we want to take that into consideration. But at the same time, we still got to make business decisions as we run the office. But to get that feedback ahead of time is going to allow you to plan. And then lastly, I know one thing that I put in the surveys is there's a lot of team members out there right now that have vacations scheduled for June, July, August. And we really have to kind of sit down and kind of go, okay, one, do you still plan on taking that time off? And kind of having the team member kind of balance in their mind. We want them to enjoy some time with their families. At the same time, this office has been shut down for a few months, and we need to provide access to care to our patients so they can come in and see us. And if we can't provide that access to care, we have to worry about the longevity of our practice long term. So getting a sense of, talking to the team members about, hey, what do you have going on? Are you good about coming back? Here's the protocols, what we're doing. And at the end of the day, how available are you to help us get this practice up and running are all key components that we need to make sure that everybody's on board with having an understanding and feeling good about portraying as they enter back in the doors of our office. Even when it comes to the patients, every day our team members arrive. Well, you know what? There's going to be some protocols we need to do. We're going to end up having to take temperatures, and we're going to end up having to triage them and ask them questions and things like that. And as a practitioner, these documents must be saved. Okay. Each person has to fill out their own paperwork every day, and then we'll take those and we'll save those in a whole different file. Don't put them in the employment file and things like that. Put it in a separate, whether it's medical file or a separate COVID file or something like that, that just makes it to where it shows as an office, we're doing everything we need to make sure that everybody who walks in our office is then triaged and, I guess, safely assessed to make sure they should be there on that day.
Kerry, you covered a lot of great things with the staff. I think, we talked about the preparedness response plan earlier, and all of this stuff is going to be documented in that. But I still think it's important to have your conversations with your staff and let them to get them to understand the importance of wearing their mask properly. There's been many times where I have a wonderful hygienist at the dental office that I go to, and a lot of times she'll be working on me, and then she'll pull away and pull down her mask a little bit in order to have a little bit of a conversation with me. That kind of stuff, we're not going to be able to do that with COVID-19. We're going to have to focus on washing our hands more often. The patient interaction is going to be a little bit different. You still want to obviously have those positive interactions with your patients. You want to communicate with them about stuff that's going on in their family life, but you want to make sure that you're following all protocols as far as the proper, what do they call it, donning and doffing of PPE equipment. So continuing to focus on sanitizing the surfaces more frequently than you are normally used to, things that are touched by the hygienist or the dentist. Those are things that are all going to be important, slight changes that are going to take a little bit more time during the day than what we're used to.
Yeah, and that's where, one thing we didn't really talk about as far as, scheduling and things like that during the day to allow just a little bit more time between patients, whether it's 10 minutes, 15 minutes, to make sure both that things are sanitized appropriately, as well as allowing patients to come in and go out without having too much interaction with one another. So that's a great point. And then we get to the end of the day. The end of the day, you sit there and go, okay, well, it's all, here we go. Well, what I think you got to take into consideration is, many offices will have on-site laundry, which is great because individuals, they can wear their home clothes to work, change into their scrubs at the office, and then at the end of the day, change back out of their scrubs, put their home attire back on, and the scrubs are able to stay right there, get laundered and things like that. So there isn't a lot of, things going back and forth from the home to the office that's been exposed to droplets, aerosols, and things like that. So the main part would be also to have your team members have a separate set of shoes. You think about things that go back and forth, have a separate set of shoes, have the uniforms and things like that, being able to stay in the office is a great thing. So if it can't happen, if people still should change before they leave, but anything that they take out of the office should be put in not a paper bag, but a plastic bag, take it home, get it right into the laundry to get it taken care of for the next day or the future time of using it.
Okay, gentlemen, we've had a chance now to talk about the policies, communicating with your patients, as well as your expectations for your teammates. You said you had quite a few operational considerations. What's the first one that comes to mind?
First one that comes to my mind is, the office has been idle for a little bit. You might have seen an emergency here or there. Some individuals didn't see any emergencies through this whole time. So now the equipment, the water lines, the air lines, and all those types of things need to, for no better word, start back up and get in a position that's safe to be used again. So equipment maintenance and getting it ready to go before the patients show up is number one on my mind. Number two, you got to sit there and you take a look at how many patients missed out on appointments during that time. Those are the ones we need to kind of reach out to. And, I guess in two ways, part of my communication initially when I announced that when we're opening back up, I'm encouraging patients, call our office. If you had an appointment that was missed during this time, call our office. And at the same time, we'll continue to reach out to schedule patients. I think that's a pretty efficient way. Instead of just having your front office person trying to reach out to every single patient, if you can hit it both ways, it should keep the timeline and being able to get patients back in to be seen timely, should end up in a pretty efficient fashion. You will have to kind of make sure that you kind of assess maybe some of your more risky patients, either from a health standpoint or an age standpoint. You might want to have those scheduled at a certain time of day that you feel like maybe it's at the end of the day, less traffic. You could sanitize right before, then finalize again right afterwards. And so that's a nice assessment that you need to kind of go through. And then the scheduling, I think we kind of briefly talked about it earlier. As you take a look at how the doctor has to, be cognizant of going from the operative or restorative from their own column or their own chair, going to check a hygiene 1 or a hygiene 2 and then coming back. I've had some offices that will take their hygiene program and start their patients in 15-minute increments or a 10-minute increment where it's offset just a little bit to allow the doc to start a procedure, then go do a hygiene check, come back through and kind of help manage the PPE usage as well as managing the overall flow of the office. And I think lastly, the ordering processes that you've always been accustomed to in your office, now's the time to really revisit that, making sure you are taking regular inventory and that you are ordering PPE often, regularly, and maybe from different vendors that you haven't. Make sure they're qualified. But right now, inventory levels and things like that are running lean. And so you may have to delineate who you're ordering from versus just going to one vendor.
One last thing I want to kind of throw in from a operational standpoint, I guess it's kind of a policies and procedures thing too, is, there's a lot of new rules and a lot of new guidelines out there from CDC, MDA, ADA, and there are notices that are required to be posted in your office for the staff to see. And, you know, one of the things that came out first was the Families First Coronavirus Response Act, the FFCRA. And there's notices in there related to the emergency paid sick leave and the expanded FMLA. Although you might be exempt from it, those notices still have to be posted in your office. There's other notices, things from the community health department in your area, or there's hygiene and safety notices. You know, in our office, we used to have signs that say, you know, if you're sick, don't come in. There's new notices out there related to coronavirus. I think it's important to have those posted around the office because if OSHA or somebody comes in to do a little bit of an audit or walkthrough, not only having the preparedness and response plan in place, but having these notices posted is going to be very important for your office.
Yeah, I think, and those are things that are very, very, very important. So the last two things I think I have on my brain right now is one, you know, with people being unemployed and they may have lost insurance coverage and things like that, one thing our front office, we're going to need to make sure that we do is checking insurance coverage, benefits and things like that to make sure not only us, but now the patient doesn't think, hey, if I have some procedures done, it's just going to be sent to my insurance company is going to pay. You know, we don't want the patient to endure any surprises, or for the practice to endure taking care of patients and ultimately not getting paid. So verifying insurance eligibility will be a key thing before the patient comes to the office. And then lastly, you know, as we talk about having a touch-free type environment when it comes to whether it's appointments, payments, health histories, any type of documents and things like that, they're going to have to be exchanged back and forth now electronically. We have to make sure from an IT perspective, security is one of the top considerations you have to go through. During all of this, the last thing you can endure is a security breach in any capacity, especially when it comes to finances or health information. So, you know, check with your carriers, double check with your security. And if you need anything, you know, there's specialists out there that just manage these types of things. Reach out to your advisors and see what type of connections they can hook you up with. But security is maybe where you need to start with before you put a lot of these things in place. That might be the number one thing you make sure that they can be managed and be handled appropriately.
Hey, Kurt, you know, Poneman is an organization that studies security for IT. And they put cost of remediation. They do studies on an annual basis. There's over 3,000 breaches that they evaluate. And on average, per record that's compromised in the healthcare industry, it's $429 just to remediate it. That's like attorney's fees, communications to your clients, and all that. So as a dentist, you can take the number of patients you have, and the 2019 numbers came out at 429. Multiply 429 times the number of your patients, and that's the quantitative risk that you've got from a security exposure.
Well, so if the average practice is 2,000 patients, that's an exposure of an $800,000 figure.
Right.
So
right.
That's a great point.
Yeah, and that only covers the remediation cost. That doesn't cover the cost associated with then putting what should be in place on a go-forward basis. So, you know, obviously, like you're saying, make sure you got the insurance covered, but then also, you know, an ounce of prevention is worth a pound of cure. Yeah. So this is all good information, guys. And I know that you wanted to talk to policies and make sure that we covered patient communication, the team communication, operational considerations. Any closing thoughts? And then the second thing is, if people do have questions or comments, what's the best way to reach out to you?
I think the closing comment for me is going to be, this is going to be a very stressful time. I think for a lot of practitioners out there, I think the next 60 to 90 days, just from the get-go, is probably going to be one of the most pressurized and demanding and stressful times of the entire career. And so take a deep breath and also get these things established so you can reference things when your mind was clear, and what the protocols that you set up when your mind was clear is crucial. You know, and if you run into things that you'd like an opinion on or a thought on, you know, I can be reached at Kurt.Nurnberg@Raymond.com, which is CURTNURNBERG@REHMANN.com.
I think for me, one of the closing comment is document what your plan was, how you're going to respond to things that come up. There's so many resources out there. I was in getting ready for this podcast. You go through all these resources and it's overwhelming for me, let alone for someone who has to focus on patient care as well. And this is not the only thing that you do with your life. So, pick one resource to cut down on all the confusion and the being overwhelmed with the amount of information that's out there, and document. My contact information is very similar to Kurt's, chris.hunt. The only weird thing there is I have a D in my name. It's CHRIS.HUNDT@Raymond.com.
Perfect. Gentlemen, thank you for your time. Very enlightening today, and we'll look forward to talking to you in the future.
Great. Thank you.
Thank you.